Hematologic diagnostic procedures. Bone marrow is responsible for the production of RBC, WBC, and platelets. The expected RBC for women is 4.2 to 5.4 million. For men, is 4.7 to 6.1. Women is 4.2 to 5.4 million. For men is 4.7 to 6.1 million. If there's decreased levels of RBC, there's an evidence of anemia or hemorrhage. Anemia or hemorrhage, the decreased levels of RBC. Expected range for WBC is 5,000 to 10,000. 5,000 to 10,000 for WBC. And if there's elevation of counts of WBC, that will be infection. Infection if there is elevated WBC. The decreased level of WBC, however, is evidence of immunosuppression. Decreased level is immunosuppression. What is MCV? Mean corpuscular volume. MCV is mean corpuscular volume. What is expected range for MCV? That is 80 to 90 mm. 80 to 90. What is MCH? Mean corpuscular HGB. Mean corpuscular HGB. The expected range of MCH is 27 to 31. 27 to 31 for MCH. Elevated MCV will be macrocytic. Elevated MCV is macrocytic. Cells, possible anemia. Oh my God. Decreased levels of MCV can be evidenced of microcytic cells, possible iron deficiency. So decreased levels is microcytic cells or possible iron deficiency or anemia. What is TIBC or total iron binding count? The normal range is 250 to 460 for total iron binding count. 250 to 460 mcg. Elevated levels of TIBC can be evidence of iron deficiency. Elevated levels of TIBC can be evidence of iron deficiency. The decreased level of TIBC is evidence of anemia, hemolysis, and hemorrhage. Anemia, hemolysis, or hemorrhage. What is the expected range for iron in females? That's 60 to 160, while in the male is 80 to 180. Again, females iron is 60 to 160 and male's iron is 80 to 180 mcg. Elevated levels of iron can be evidence of hemochromatosis, iron excess, liver disorder, or megaloblastic anemia. That will be for elevated levels of iron, you have hemochromatosis, iron excess, liver disorder, or megaloblastic anemia. The decreased levels of iron can be evidence of iron deficiency, anemia, or hemorrhage for decreased level of iron. What is the expected range for platelets? 150,000 to 400,000 mm. 150,000 for 400,000 mm for platelets. And if you have increased level of that, you will have malignancy or polycythemia vera. High level will have malignancy or polycythemia vera. Decreased levels will be autoimmune disease, enlarged spleen and bone marrow suppression. Autoimmune disease, enlarged spleen and bone marrow suppression. Expected HGB level in females is 12 to 16, while for male is 14 to 18 grams for HGB. Decreased levels of HGB is anemia. Negative HGB is anemia. Hematocrit for females is 37 to 47. Hematocrit for males is 42 to 52. 37 to 47, 42 to 52 for males. That's for hematocrit. Decreased levels of hematocrit can be evidence of anemia. Types of precautions do you use in collecting and handling blood from specimen collection? Standard. The standard type of precautions. Hematologic tests are usually available primarily within 24 to 48 hours. So, hematologic tests are usually available within 24 to 48 hours. Final hematologic tests are available in 72 hours. What is biopsy? Biopsy is the extraction of a very small amount of tissue, such as bone marrow. Biopsy is the extraction of a small amount of tissue, such as bone marrow. It is used for blood disorders and to rule out diseases. Biopsy is used to diagnose blood disorders and rule out diseases. A patient is about to undergo a biopsy, and the client should be in prone or side lying position to expose the iliac crest for the procedure. Prone or side lying position to expose the iliac crest for the procedure. Biopsy client teachings. Client can feel pressure and brief pain during the aspiration. Client can feel pressure and brief pain during the aspiration. How do you control bleeding during a biopsy? Apply pressure to the biopsy site. Simply apply pressure to the biopsy site if there is controlling bleeding during a biopsy. What is the type of dressing do you place over the biopsy site? That's called sterile dressing. Sterile dressing is a thing that you place over the biopsy site. After a biopsy, what medication should you avoid? Aspirin. Do not give aspirin for a person undergoing or after a biopsy. How often do you check the biopsy site? That should be done daily. Post procedure should be done daily. And let's talk about PT or prothrombin time. The expected range for prothrombin time is 11 to 12.5, 12.5, 11 to 12.5 for the expected range for prothrombin. Oh, that's 11 to 2.5 seconds or 85 to 100% or 1-to-1 client control ratio. Increased prothrombin time can be an indication of clotting factor deficiency. Increased level of PT is clotting factor deficiency. Decrease of PD time can be evidence of vitamin K or vitamin K excess. Decreased PT time can be evidence of vitamin K excess. INR labs are useful for warfarin therapy. Warfarin therapy uses INR. D or dimer measures hypercoagulability of the blood. Hypercoagulability of the blood is a dimer measures. Elevated D dimer can indicate decreased ability to clot. Elevated D dimer can indicate decreased ability to clot. Fibrinogen levels reflect available fibrinogen for clotting. The levels reflect available fibrinogen for clotting. Decreased fibrinogen levels can indicate daily ability to clot. Normal fibrinogen levels is 170 to 340 mg, 170 to 340 mg, and a normal fibrin is less than 10 mcg. Normal fibrin degradation product levels is less than 10 mcg. Fibrin degradation products increases whenever there's clotting dissolving ability is occurring. Clot dissolving ability is occurring. Fibrinolysis is clot dissolving activity. Fibrinolysis is clot dissolving activity. So, yeah. So, yeah.